Hello, everyone, and welcome to this audio podcast. This audio podcast is part of the series, the Storm Solar. This audio podcast is part of a chartered edition, an evidence-based edition, an audio podcast is part of a Stellular Impeach, and this audio podcast is part of the Rupture feature, and this audio podcast is part of a Storm Robotics production. In this audio podcast, now delving into the results or the analysis and the results in around this works understanding education for healthcare service users aligned to social media platforms, and where this works looks to highlight some descriptive data between pediatric and adult nephrology social media platforms, and where this works is part of a sort of a clinical correlation peer review publication anticipated sort of in early 2024. Um, um, so in around the results, in around the results, the RPSG has over 10,000 service users, and KDOS has over 2,000 service users internationally. And between the two social media platforms, the international social media platforms, 2,560 threads were tagged against 14 different topics or themes, and the results or the analysis and the findings sort of inform that patients or service users between both adult and pediatric cohorts require additional support across several areas of across several areas of kidney care. And the data the data, although not generalizable, although not generalizable, the snapshot the snapshot the data provides a sort of a snapshot of where healthcare education has been neglected for renal patients. And results also inform that social media groups or platforms between both pediatric and adult cohorts are only as effective as the moderating or administration and research teams who help drive patient inclusion and involvement. Um, and in around the sort of in around the descriptive analysis in around the RPSG in around the RPSG after topic tagging after 2 weeks, descriptive analysis revealed three of the main online topics or themes and discussed or highlighted for adults with adults and for adults and uh, included renal replacement therapy or kidney replacement therapy such as dialysis and transplantation. 100 There were 166 tags, wherein were just under 13% of the tags represented under this specific theme. And secondly, lab tests and biomarkers, wherein 137 tags were linked to lab tests and biomarkers, and 10.5 or just less than 11%, just under 11% of the themes were linked to this. And the third included medication and pharmacy, wherein there were 135 tags, and again just under 11%, just under 11% of the tags were linked to this particular theme. Um, uh, in the RPS Amongst the RPSG at the time of this works, when this works was carried out. 1,311 topics were tagged and applied over the 2 week duration between March and April 2020. In the KDOS social media platform, after topic tagging for 2 weeks, descriptive analysis revealed three of the main online topics or themes discussed surrounding pediatrics and young people related, highest being medication and pharmacy, wherein 148 topics were tagged, just under 12%. The second included renal replacement therapy or kidney replacement therapy, wherein 133 tags there were 133 tags and just under 11%. And third included peer support, where there was 125 topics tagged, just around 10%. And one of the fourth highest included around nursing or nursing care, where there were 115 tags and just around 9.2 or 9.2%. The number of topics tagged specifically through the KDOS social media platform were 1,249, and again over a 2 week duration between March and April 2020 through the KDOS social media platform. Now, the data highlighted in context in regard to the RPSG and KDOS social media platforms the RPSG and KDOS social media platforms in context of 2 weeks on where topic tagging where the topic tagging activity took place between 2 weeks between 2 weeks per social media platform, and thus a total of 1 month over a 1 month duration, or 4 weeks. Now, more retrospectively, however, the team in this works have quite nicely sort of looked at the data more retrospectively, since topic tagging also allowed looking at data through the social media platforms, sort of more retrospectively. So a little bit in around some of the data in around this. So in the RPSG, at the time of carrying out this, when this works was carried out, some data was carried out, some analysis were carried out also over 10 years. So, and through the RPSG, conducting a 10-year retrospective descriptive analysis of topics and tags through the RPSG also helped reveal the most important discussed topics and trends. The most prominent topics in 2020 focused on renal replacement therapy or kidney replacement three, and there were 39 tags in around 23%, 23%, but around 39 tags, 23%, and in total there were 163 tags, 163 topics, sort of topics in around kidney replacement therapy or renal replacement therapy. Sort of looking at 2014, between 2014 and 2015, focused on there was a focus on lab tests and biomarkers, and there was 44 tags or 32 44 tags or 32%, but in total there were 130 137 137 topics tagged in that during that through that duration between 2014 and 2015. In 2019 was 2019 data highlighted that the topics that there were more discussions in around different medications and pharmacy. There were 20 topics tagged in around 20 topics tagged, and in around 14, just under 15%, and 134 in total. And then there were in 2019 through the RPSG platform, over that 10-year retrospective analysis. There was data to inform that nutrition aspects of nutrition were tagged, were also discussed through the social media platform, and where there were 28 tags, and just over 24%, and 115 topics or tags, 115 in total. In 2015, biopsy and surgery was also important. There were 18 tags, or around 19%, and 97 total. Lifestyle was a leading topic in 2020. Lifestyle was a leading topic in 2020, through the RPSG. There were 24 tags, or 23, at around 23%, or 92 in total. In 2015, psychology was also a crucial topic or theme. Topics around the psychology aspects around kidney care or nephrology were important, where there were 14 tags and just under 17%, and a total of 85. And the trend also revealed that wellness and well-being in 2020 was also important. There were 24 tags, and just under 30%, and the total was 82. In 2015, also, the topic trend revealed that nursing aspects around kidney care or nephrology were popular, through the RPSG. There were 14 tags and just under 21%, and there were around 69 in total. In 2015, also the topic trend also highlights that physical activity was popular. Popular discussions through the RPSG, in around 13 tags, and just under 21%, and 64 in total. In 2014, the topic trend revealed primary care. Aspects of primary care were important. There were 12 tags, or just under 19%, and 64 in total. And 2015 trends revealed that electronic patient records was popular. There were 9 tags, or just under 19%, and 49 in total. And finally, in 2013, trends revealed that peer support was most popular. There were 8 tags, and just under 21%, and 39 in total. Now in KDOS, going into KDOS, now the KDOS data sort of retrospectively was a little bit different, since KDOS was established in 2015 versus where the RPSG was founded in 2009. And so in 2009, so KDOS data goes back as far as 2000. as far as early as 2000, around 2014, at least where the research team look to establish data as retrospective as it could through the KDOS social media platform. So over the 6 years, the data reveals as thus. So conducting a 6-year retrospective descriptive analysis of topics and tags through KDOS help reveal important topics and trends. Most tagged topics highlighted that 2019 was perhaps the most important was one of the most important years for analysis and trends since the sort of initiation of the social media platform. So unfortunately, it didn't go back. The data doesn't go back as far as 2014, as far as 2014. The earliest it was in around 2019 when data started. When service users and members through the social media platform started highlighting the most important aspects around nephrology or kidney care for pediatrics and young people. So in 2019, one of the most prominent topics in 2019 focused on medication and pharmacy. There were 43 tags, 43 tags, and just under 26%, and 148 in total. In 2019, kidney replacement therapy or renal replacement therapy was also an important focus in the pediatric renal population. There were 51 tags and just under 39%, 133 in total. Descriptive analysis surrounding peer support tag. The peer support tag was a critical subject or focus for the pediatric social media platform. There were 38 tags and just under 31%, and total 125. The nursing topic tag was important. Analysis informed 35 tags or just under 31%, total of 115. Lab tests and biomarkers topic tag analysis revealed 29 tags and around 27%, a total of 109. Psychological support was an important or crucial topic for pediatrics and young people. Around 21, there were 21 tags, or around 27%, and a total of 91. Biopsy and surgery was fairly important. There were 33 tags, and in around just under 37% and 91 total. Lifestyle was important. Lifestyle was important. In 2019, and in around 2019, there were 25 tags, 25 tags, and around 19% and 25 total. Psychology, in around the trend. Yeah, the trend in around psychology was also important in 2020. In 2020, data or descriptive analysis through the KDOS social media platform. The trend in around psychology also linked. So where psychology in context of the KDOS social media platform, there were tags that were linked to a topic or theme in around wellness and well-being. So the trend revealed that when wellness and well-being in 2020 was important. There were 14 tags and just under 24%, and a total of 60. In 2019, also a topic trend highlights physical activity was popular. There were 18 tags, or 31%, and 59 in total. And 2019 analysis also revealed primary care was most important. There were 20 tags and just under 19% and 64 in total. And finally, also in 2019, the trend highlighted that electronic patient records, or EPRs, was popular, around 12 tags, and 12 tags or 20%, and 43 in total. So so that draws this audio podcast to a close. Some descriptive data to inform of some of the most important and pertinent topics that have been identified through the social media platforms, sort of retrospectively between the duration of 1 month between social media platforms, but then also sort of retrospective data 10 years through the RPSG social media platform, and then 10 years through the social media through the RPSG social media platform, and then 6 years, the initial 6 years through the KDOS social media platform, totaling close to 2 decades, or 16 years, more specifically. So that draws this audio podcast to a close. This audio podcast as part of a Ztorm Solar. This audio podcast as part of a chartered edition and evidence-based edition. This audio podcast as part of a Stellular Impeach, and this audio podcast as part of the Rupture feature. This audio podcast as part of a Ztorm Robotics production.